All right. So I'll just start from access to care. Okay, kind of. So in regards to access to care, sometimes the patient has difficulty actually going to the doctor, transportation. They may not have the money or insurance coverage to actually go to the doctor and pay for their health and wellness visits. And then the quality of care sometimes can be an issue because they may not have a good relationship with their physician. They may feel that they're being neglected or they're being treated a certain way, and it'll prevent them from going back to the doctor. They may have issues with the receptionist where they're trying to get their appointment set up that they feel that the receptionist is mean to them or looking at them a certain way because they know their history. So there's all types of other things to consider and to be aware of when it comes to HIV management. There's patients assistance programs by the various drugs companies, because we've already said that these medications are very expensive, but you have some drug companies that will either provide the medications at a no cost or a reduced cost for certain patients that qualify for their patient assistance programs. Social issues and mental health, like I said before, depression, psychosis, suicidal thoughts, all those things occur on a daily basis in those patients that may suffer from HIV, and that's because they may feel isolated or they may experience some type of prejudice or other disparities in regards to their health, their ethnicity, their gender, things like that. All those things come into play, and that can play a part in a person's mental status, their mental health, and any other social issues that they may be experiencing, whether that be reduced income, no income, not being able to apply or obtain a job, retain a job, different things like that. Those are all various things to consider when dealing with this population. Specifically, when it comes to your highly active antiretroviral therapy, would be adherence. Adherence is one of the major things, and I cannot stress that enough, and you shouldn't stress that enough either. Adherence is probably one of the main reasons why we have so many people that become resistant to their medications, or they have to use those last resort drugs or no drugs at all. And that's because they've gotten to the point where no medication will work for them. And if they would have taken their medication or done the things that they were supposed to do early on, then they wouldn't be in the state that they're in. So you want to try your best to promote adherence as best as possible, preventing HIV resistance, whether it be through patient education or awareness of what resistance is and how it can affect them. And then also understanding that there is a lack of understanding among healthcare professionals. Some people in the healthcare profession, they don't care, or they may not know, too much or the pertinent information that they need to know about HIV. So they may not understand the role of triple therapy when it comes to the HIV medications. They may not understand the impact of a person's socioeconomic status and how it affects them and the things they can and cannot do, because if a person has a reduced income, sometimes they may choose to put food on their table rather than going to their doctor because they have a family to provide for. So those always are things to consider. They may not be able to afford therapy, they may not be able to afford access to therapy or to care. So those are things that you have to be able to assist with your patients, whether that be directing them to some patient assistance programs, some free clinics, other programs that may be being produced by health departments and other healthcare agencies. Those are all things that you can do as a healthcare professional to help treat the population, not only with the various prevention strategies, but also through educational means. So lastly, I hope that I was able to give you all a good understanding of the role of the healthcare professional in providing care to HIV infected patients. There's a lot that we can do. Doing something is enough. It's a step in the right direction, because if I've already given you the facts about we have X amount of people infected with HIV, we have X amount of people that are becoming infected with HIV, and the virus isn't going anywhere, the disease isn't going anywhere for a while, because you still have people that don't know to use a condom or to go get tested. Once they become infected, they may become angry, so they may try to infect others. So there's a lot that we can do, but the main thing that you have to realize is there are medications out there that have been proven to help slow the progression of the disease. That when in regards to the medications, there are adverse effects or side effects and patient complaints. There's a lot of them, but you have to try to reassure your patients and encourage them to talk with their doctor about what they're going through, because sometimes the patient may be too afraid or too shamed, or they may not have a good relationship with their doctor or their healthcare provider, and you may be able to speak for that patient. You may be able to speak on that patient's behalf to help curtail whatever issues that they're experiencing. Always be cognizant that this is a sensitive population. What do I mean by sensitive? Like we said before, HIV, it's not the popular disease. It's not, everybody don't want to know about HIV. Everybody don't want to deal with people with HIV. I posed a question to a forum group that I talked, panel group that I talked to, and I said, if I brought in a person that had HIV, how many different reactions would I receive? Some people would be sad, some people would be afraid, some people would be angry, some people would isolate themselves, some people would leave, some people would embrace them. There's different things that will occur, but it's good to recognize that this is a sensitive population and precautionary measures have to be taken in treating these patients and dealing with them, because you can't just jump down a person's throat because they're not taking their medication or they're not going to the doctor. Maybe you just need to ask what's going on. That's always important. So always keep that in mind. Know that you are a source of information for those that think they know about HIV, don't know about HIV, and just want to be refreshed on pertinent information in regards to HIV. You have to always be a continuous source of prevention, treatment options, management for those people that are in the community and across the world that do not know too much about HIV, and it's your job as a healthcare professional to help promote and let people be aware of where we stand in the fight against HIV. So with that, thank you all for your time and your attention, and I hope you all enjoy the rest of your day. Thank you.